Well, now on your feet at 5, the CDC has changed its guidelines regarding booster shots for certain individuals. There is a major drug shortage you need to know about, and Pfizer is already manufacturing child-sized doses of vaccinations in anticipation of children's approval.
So we turn now to senior health correspondent Monica Rabbits with the latest on all that. Still a very busy day for you.
Everything changes
Constantly.
but let's start with the CDC updated booster guidance. So this impacts those over age 18 who are moderately and severely immunocompromised. The CDC now says those individuals who had the Pfizer or Moderna shots, including the third booster, can get a fourth booster shot 6 months after their third of any of the vaccines, including the Johnson & Johnson shots. So for these folks, their third shot is actually considered an additional dose, but the fourth shot would be considered their booster, and they would receive a half dose in these cases. What you need to do, keep it simple, talk to your doctor if you happen to be in this group. Meanwhile, Pfizer already producing pediatric doses of its COVID-19 vaccine for children 5 to 11 years old. Yesterday, an FDA panel approved the vaccine, but the FDA still has to issue an official decision. Then next week, the CDC will take up the issue. The child-sized doses have orange lids, so they won't be confused with the adult doses. And if they get the green light, they'll be ready to ship them immediately across the country. The government already bought 65 million pediatric doses.
Wow. Okay, what's this drug shortage all about?
Yeah, you may have been hearing about this. First of all, we've had drug shortages for years, but the FDA has about 113 medications on its shortage list. This is the worst it's been since 2011, when that shortage was twice that amount. So the top drugs in short supply are for chemotherapy, heart conditions, and antibiotics. And most of the shortages are due to pandemic-related logistical issues, including trade restrictions. But hospitals are able to swap out drugs, and our local systems tell me they are not in a crisis situation, but they are dealing with those shortages. So it is something that you need to talk to your doctor about, but in most cases, we're talking injectables, the types of things that the hospitals would be using. So, and the better news is that a lot of times these interruptions are short term.
Thank goodness. Still so much going on, and I'm sure we'll be chatting some more pretty soon.
You know it.
Yeah, we'll see you tomorrow, I bet.
You got it.
Thanks so much, Monica.
Thanks.